I will give you to control your fever. These everything you need to tell her. Okay, this is how we means you need to verbalize entire what you learn in intermediate. Management plan come from your intermediate. Remember that. If you give short management plan like this, as you say, I will do tummy, I will keep your observation room, I will do tummy scan, and then I will refer you to surgery. So why this patient came to ED? What's your job? Your job is that where necessary referral, you go for referral. Where not necessary referral, you need to treat this patient on your own place and then discharge this patient. This is what I want to focus in this webinar. The normally what we learn, what the people say, okay, you relevant to specialty, okay, you involve. So why the patient come to ER? If you, all patient we should refer, but we don't need to have a place in the ER. Yes, we need to manage the patient, which we can manage. Okay, we have a screening tool. We need to follow that guidelines, and which patient need referral, we need to refer. Not every patient to referral, okay? So you need to be very careful in your management plan. Next, we have acute cholecystitis. Okay, so this is how to say in simple words, inflammation in your organ, which is beneath your liver, we say gallbladder. So simplify the words, not like diagnose acute cholecystitis. And what patient, is this patient need a surgical intervention or not? Anyone can tell me about acute cholecystitis? Is this patient need surgical intervention or not?
It is not necessary. If it is acute cholecystitis, patient doesn't need for surgery. But if there is a history of gallstone, then patients should go for surgery.
Anyway, well, good, very good. You said right, but I want to tell you, most likely it's due to gallstone, right? If the patient has a fever already developed and systematically unwell, like nausea, vomiting, go ahead for surgical. This need removal. But if the patient present to you gallstone, but not with the infection, okay, just a gallstone, and patient asymptomatic, you just complain about the pain, you can safely discharge, okay? But a patient with cholecystitis, you need surgical intervention for that, okay? Okay, so next is infected, obstructed kidney. So anyone can tell me the management plan for that? I need the good management plan, okay? Don't need to rush suddenly, like go ahead with the urologist. No. Good management plan, the real doctor, real emergency physician you are. Okay, anyone? Follow NICE guideline. Okay. Anyone can tell me about the stone, kidney stone? Okay. Anyway, no problem.
From the information we have,
Yes.
I've gathered, it seems like you have a stone in the kidney, which is the urine and cleans your body. So from here, we will, first of all, I would like to get some tests, and I will give.
Okay. Okay.
If the stone is small, then I will give you some medicine by which it can pass away on its own. And if it's not small, then I will refer you to urology.
Yes, very good. Excellent. So the less than 10 we will discuss. If you agree, we will wait and watch. Can give you medication it can be expelled. If not, then we will go for, I will refer you to urology. If it is already less than 5, you just give the painkiller and wait for watch and discharge this patient with safety leg flat, okay? If less than 10, then you need both to talk, patient and doctor, to decide what to do, okay? Can you hear me, guys?
Yes. Okay. Yeah.
Okay, that's good. So this way you can explain to the patient less than 10, both will discuss, less than 5, safety net and discharge the patient. This is your work in ED, not like patient is okay and just the scan come normal and okay. Can anybody tell me what investigation you will do for the colicky pain in the kidney stones? What NICE recommend us?
We will do
Ultrasound KUB.
No.
Urine, urinary.
CTKUB.
NCT-KUB, sir.
We will do
NCT-KUB.
Yeah, in adult, CT, non-contrast. In children, ultrasound. In pregnant women, also ultrasound. Okay, that's good. Okay, the painkiller, yeah, answered we give. Okay, let's go for next is intestinal obstruction. So you will see the dull colicky pain, patient may be vomiting, constipation will be complaint also, abdominal distension, history of previous abdominal surgery, cancer or hernia. You will find out, you will get this information in a history. So once you confirm, you just say in simple words, according to your data, based on your information, I found that you have bowel obstruction. So what I'm going to do, I am going to keep you here observation, not by mouth. I will give you, if patient is vomiting from long time, this will give him fluid by vein through vein, you will tell him, and you will do the investigating x-ray, okay? Then you will have to say, if I found your small bowel is obstructed or there is problem in small bowel, well, I will refer you to surgery. We will also try one procedure called decompression. I will pass a tube, okay, in your digestive tract and release the obstruction or open the obstruction. This way also, if it is a large, and then you can tell them it depends in which part. If it's upper part, I will do again pass the tube from your mouth and to release this obstruction or open the bowel. If it is a down part sigmoid, then you say we will do a camera tube, okay? We will pass from down and to open the obstruction. But if it's fail, then requires surgery. You just need to, it's not your job, but you just need to tell him this is the management plan. This is surgery doctor will do, not you will do, okay? You just need to explain him the plan. What will be the plan after confirmation of the diagnosis? You will say after investigation, if it is what I'm thinking, obstruction in your large bowel or small bowel, problem in your small bowel, you just need to simplify the words and then give the management plan. Or you can say the surgeon doctor will do like this. They explain the management plan, okay? Mesenteric ischemia is not very common, but it can come to you. These are the features, so I'm not going in detail. So this needs a surgical intervention, okay? Okay, it's not very common. Rupture, ectopic pregnancy, not really you will have it, but we have a station with PID, we will discuss on that. Abdominal elderly, it's not really likely to you have, because most likely this patient already syncope, so you will follow WHO approach, not this one. Okay, so let's move to the next slide. Now we have a very important slide. This station is very, very common. Means the acute cholecystitis, acute pancreatitis, acute appendicitis, these stations already came up many times, okay? The problem is that these stations look very, very, how to say, very simple, but they are very complex if you do not explain patient nicely. Okay, we have this one, headache. So what is the management plan for the tension type headache, guys? Need a plan from NICE guideline.
Subcutaneous sumatriptan.
Tension type headache.
Simple paracetamol.
And if it is
NSAIDs.
yes, very good. And if it is a chronic type of headache, what you will do then? then you will refer this patient or make an appointment with the physiotherapist for acupuncture. Acupuncture, you will simplify the words. You say it's a procedure, it's traditional Chinese medicine procedure, but it will help you a lot. Okay, you will explain like that. So could you please tell me what more advice you will give to this patient? What advice you will give to this patient, guys? Hello?
Avoid aggravating factors like daily activities.
Yes, you can ask him to do exercises, you do your daily work. Many things are there. Means keep himself like outer environment, get away from the stress which is giving you. So these are things you need to give him, or you can just simply explain, I will give you a printed leaflet. That's it. That's fine if you explain to him. Okay, migraine with and without our. So could you please tell me what is the management plan for the migraine? Yeah, you need to give him NSAID. Sumatriptan, yes, good. Yeah.
We have to explain him that first of all we'll explain what you've got is basically migraine, and it's a kind of disease which only half of your head will have the pain. And I need to explain to you that you most probably have some triggers which you have to avoid, and you have to find what your triggers are. It can be hunger, it can be tension, it can be lack of sleep, it can be thirst or feeling hungry. And then I will explain to the person. I will ask specifically if the pain how frequent the pain is. If it is more than thrice in a month, then I will ask him to take a proper treatment for proper treatment for 6 months. And otherwise, I will prescribe him sumatriptan or NSAIDs.
Okay, good.
We can start with paracetamol.
Yes, you can. Of course, you can. Okay, so we have
can
this.
Also we can also advise for plenty of water. It means a good hydration, and also for stool softness if need patient, and we add also a medication which is for migraine.
Okay, good, very good. So the migraine unilateral can be bilateral. So when you take history, you will know about it, and aggravated by or caused by daily routine activities, daily living. Okay, let's move to cluster headache. So what is the management plan for the cluster headache, guys?
Oxygen and subcutaneous.
Yes, very, very simple, and oxygen, yeah. So can we give the oral sumatriptan?
No.
We need to give, yeah. Good. Yeah, next is our, next we have giant cell arthritis. So what is the treatment plan for that?
Steroids.
That's right. Yeah.
Steroids therapy.
And what would be your, what you have to do? You need to same day referral to eye physician. Okay. Same day referral to eye physician. Why? To protect the vision loss. Okay, to prevent. Got it, guys. So we also see if we can have time to practice. Okay, let's move to the next slide we have right now is about the chest pain. This is also very common stage. Very common. So pericarditis, we almost already discussed about that. And the myocarditis, similar to that, is symptomatic treatment. You can, if pulmonary edema develop, then you have to admit this patient. Otherwise, you can discharge. The next is angina. So we already discussed about that. Less than 20 minutes with exertion. Think about angina. You need, how you will treat angina. You're right. How would you discharge this patient from ED? A patient came up with the angina. It's not unstable, okay? It's typical. How would you discharge this patient? if he came to you with following complaints, like he would say, I have this pain or I have breathlessness when I'm doing exercise or I'm doing work, how would you destroy this patient from ED? You will give him
what?
This patient doesn't need admission. You can destroy him with GTM. Okay. Number one. Number two, you will give him beta blocker
Aspirin.
or yeah.
We will give aspirin, beta blocker.
Yes,
yeah.
yes,
We will start treatment, secondary prevention.
Yes. First, you will give him the treatment GTN, then you to also advise, okay, then beta blocker, then you will go for blood thinning medication if required, like aspirin. Then you need to give him advice, okay, to avoid the too much working, do not do strengthening of exercise like this, secondary prevention, diet modification, statin drugs if required. So these all things you need to give. Okay. Next is our last one is SCS, acute coronary syndrome.
And can we send this patient also for follow-up in cardiology?
Yes, you can say follow-up, no problem. But you don't need to go, oh, I going directly say I want to refer this patient to the cardiologist. So why you or an ED? This question can be raised. Yeah. So you need to be very, very careful. That's what I always stress to any candidates who came up to private message. I say, please, the patient needs an ED treatment, you need to go for it. Don't need, okay, any patient comes to you and you just quickly say, I want to refer there. So that means you lose your score, okay? So next is we have acute coronary syndrome, unstable angina, very, very common. So you will have this, and what you will do if the patient presents to you with that?
Investigation.
You will keep in the research room, right?
Yes.
And admit him under the cardiology, right? And then you will give your treatment will be what?
Yeah.
Your treatment. What would be your treatment?
We will load the
We will be giving 300 milligrams of aspirin.
Yes, good, very good.
Beta blockers, oxygen, painkiller, ECG
We
tracer,
will first of all
and
we'll
TROPS.
put the patient to the research room.
Yeah. Yes, you're right, guys. Yes.
Either it is non-STEMI or STEMI. Treatment depends upon presentation actually.
Will determine whether
But you know, this chest pain, if you are going to think about is going to be MI, you need to admit this patient, okay? And involve the cardiologist, you must. Then you need to explain him why do you involve the cardiologist. You need to tell the patient what cardiologist will do. You say, if it's confirmed is MI, in simple word you say heart attack, then what the cardiologist will do, will pass a tube towards your heart and to open the blockage vessels to help you to get your heart should pump well to meet the demand. Like this, you need to explain in simple word. Please remember, if you are very familiar with any topic and you are sure what you are going to say, make sure you need to simplify things in your own words. Do not need to follow every time exactly to me, to others. You can create your own, but make sure you're a safe doctor, okay? Okay, that's great. So now we are going for next one. We have sciatica. This is also a very common station, but you can have different form. You can have in the form of history taking, you can have in the form of examination. Okay, we will discuss an examination in the future, but right now we are focusing on the history taking. So you will find unilateral leg pain, radiating below the knee, etc. This is all presentation. What is the management plan for sciatica? Please make sure you must tell me advice as well. Okay, anyone? How you will say about the sciatica in your simple words and the management plan? Guys, can you hear me? Anyone?
it seems like you have a
Yeah,
disease called sciatica, in which there is a nerve which is passing from your buttock downwards, and that's being compressed due to whenever you carry some heavy weight or due to posture. So the most important advice for you is that you don't have to lift heavy weight, and when you bend, you will not bend on your back, you will bend on your knees to pick things up. And your lifestyle is very important. You might have to change your mattress and get the mattress which is more comfortable for you. And oral says nothing else to worry. You need to rest after a long after a difficult day, and it's very important for you to take painkillers, and painkillers and some muscle relaxant will relieve your pain a lot.
We will also suggest physiotherapy for this.
Yeah. Okay. You will simplify your word. Based on your information, or you can say according to your data I collected from you, the most likely seems like there is a displacement of one small bone, or it's actually cartilage. You can say the disc we call it is displaced from its own position, which is compressing the nerve go to your leg. Means more simplified, and that's why you're having pain. Okay, it means more simple. So what I am going to do, but there is nothing to worry. Fortunately, it's not. If it is relevant to when you take the history, if the patient say, "Oh, I take one heavy weight" or something like that, then you will understand it. So then you say there is not really to worry. This is self-limiting condition. I will give you painkiller. You can say it will goes on its own within 4 or few weeks to few months. Few weeks to few months. This is according to NICE guideline. Okay, few weeks to few months. So what you have to do, my advice is that I will give you printed leaflet, but you can highlight the advice like that. You will say you need to keep on going with your daily activities. Do not take bed rest. Okay, you don't need to encourage the patient bed rest. Okay, number one, you keep going with your work. What you are doing is also important. Avoid heavy lifting. As long you have any pain, once you get relief from that, you can do whatever your activity you are doing. Like this way you can make. Got it, guys? I mean, more simplify sciatica. Some people understand, but what to say? To make more simple would be give you more score. Just to collect each score that will be help you. It's clear so far?
Can we give muscle relaxant in it?
There is no, I don't think so. The NICE guideline recommend us. I couldn't find it. Okay.
Can we suggest some
yeah, physiotherapy, yes.
Yeah.
Physiotherapy,
or,
yes.
Yeah, or some medications like pregabalin, etc. Like we used to.
With simple sciatica, no, you don't have to. Okay.
Okay.
The simple sciatica, according to NICE guideline, no need, because it's mostly stressed onto self-limiting just to control the pain, and this will go on its own. This is what have been seen. I found in the NICE guideline, so I'm going for according to, I don't want to add any extra information. Yes, muscle relaxant. Yeah, when I was doing internship, I remember I was prescribing that, but since I got with the MRCEM and I moved, and I found that these use was not necessary for, especially for sciatica. Okay, Cold-Agglutinin syndrome. This is actually a complication of sciatica. Okay, that means red flag of sciatica. That means you will have bilateral sciatica. Other symptoms like difficulty in nervous system, a motor system, also sensation, means your nervous system will be involved in that. So in this case, you will explain to the patient. First of all, you will lie down the patient on the bed first. Then you explain I will do investigate. What investigation you will do in this patient, guys?
MRI?
MRI spine.
Yes, MRI spine. And you will refer this patient to whom? Neurosurgeon. Or spinal surgeon.
Orthopedic,
you can say both. Yeah, spinal surgeon or neurosurgeon. According to NICE guideline, because I'm not going to practice any other thing, I want to focus more NICE guideline that you shouldn't lose. This is, I want to stress out, because this RCM especially made your 3-step like that. First step, you basic. Second step, clinical. Third step, practical, that you apply knowledge which you learn from the second step. This is very important. So you should follow everything which you learn in intermediate. Okay. Our next station is, next slide, is about the patient will present to you joint pain, maybe knee joint or knee pain or anything he will say in arm or in hands like that. Osteoarthritis, the most important to no longer than 30 minutes. This is morning stiffness, no longer than 30 minutes. But in another one is rheumatoid, so you can find it's longer than the even greater than 1 hour. So this is also in other joints. So I don't think so. You need to go in very deep, but you can explain him that you will refer to rheumatology. But if you find this osteoarthritis, you can destroy it with the painkiller. And if there is, you can also say, if the investigation or the test, which I'm going scan of your X-ray of your knee, if I found there is a fusion of your bone, in this case, I will refer you to the orthopedic. If there is no, then I can give you painkiller. You can add some other medication then you can destroy this patient with printed leaflet. Okay, this is also very important station, but usually it's come up with the examination, but you can have in history taking. Okay, so what is the treatment for acute limb ischemia, guys? Anyone can tell me management plan for acute limb ischemia? It's a very serious condition.
So we can start anticoagulants and consult for vascular intervention.
Get vascular referral followed by revascularization.
Excuse me. Could you please mute your mic? Thank you. Yes, you need to vascular surgeon, but what you will do, what intervention you will take, you will give him painkiller. Okay. Do the examination. You will explain to him. Do examination. Examination will include the power of the limb, the sensation of limb. Okay. And then you will refer him to, because it's need urgent intervention sometimes, so you need to refer to vascular surgeon. How about DVT?
Acute decompensation or changes,
we will do well score for DVT, and then we will decide whether we have which route we have to take.
Yes, very, very important. You need to do the well score. You must verbalize this. We have special criteria. We have special scale for that. If it is, okay, what is normally we do the ultrasound, leg vein ultrasound, if the 2 or more than 2. If it is less than 2, then we can either think we will do D-dimer, but we can put another differential as well. So if you need to verbalize that if this test came normal, then I will discharge you with the safety leaflet. I will give you painkiller. Can be another cause, okay? So don't say like DVT and you didn't take the score and you just quickly refer to the vascular surgeon on anyone. So this, you don't have to make mistake. We need to take the score. You need to take the score. Okay, so, and also you need to verbalize your score is 2 or more than 2. I will do the ultrasound. While waiting for the result, I will give you a medication called anticoagulant. Okay. Once, if I found the ultrasound is positive, I will refer you there, or I will discharge you with, but you need to refer, it would be better. Or I will arrange a follow-up with the vascular surgeon. If it is abnormal, then I will go for a D-dimer, another test. if it is also if it's the abnormal, I mean, means you have DVT. So I will continue the treatment anticoagulation for 3 months, like the period of time you need to mention. Okay. So next slide we have is the PID and ectopic pregnancy. So when you take history, you will know it. So what is the treatment of PID, guys?
It's IV antibiotics.
Antibiotics.
1 gram ceftriaxone, tetracycline, deoxycycline, and one more. Metronidazole.
Metronidazole.
Yes,
Metronidazole.
yes, that's correct. So, and what you will do next, you will arrange what? Follow up with genitourinary clinic, okay? Gum clinic, we say. Okay, this is about PID, ectopic pregnancy. You need to arrange follow-up with the gynecology, but could you please tell me what 2 intervention would be required this patient? How will you explain what maybe the patient will ask you, so what would be the management plan? Or if you refer to gynecology, what they will do? Maybe she can ask you this question. So what will be?
You have to explain that.
Yes, you will explain 2 things. There are 2 kinds of intervention. One is medicine. They will give you medication. Number 2, the surgical intervention, D&C. You need to verbalize that to her. The gynecology team will decide what will be better for you, what step you needed, and you need to explain. Okay, medical treatment and also surgical intervention, both. Okay, so this is what they say. Excuse me.
Yeah, if this ectopic has ruptured, then it's going to be an emergency. So then the patient has to be rushed to...
you know that the ectopic pregnancy patient, I don't think so, or they will give you, because this can be collapse anytime. Okay. Yeah, so the most likely the patient with the ectopic pregnancy, maybe she will just come towards you, maybe with the pain, or maybe she will say the ODPAR approach, not with the pain. Maybe she come for vaginal bleeding in this.
Okay.
Yeah. Okay. Because if there's a collapse patient come, because this patient can be collapsed anytime, I don't think so they will ever give you this kind of station. But anyway, you should be ready. Acute sore throat. This is also very common station. This came in London, but it depends. Again, you need to go for fever pain criteria. They want to test you what intervention you will take it. Okay, so this is the score 0 to 1, no antibiotic, give advice only. You will say to patient, there is nothing to worry. It's a self-limiting condition. It will be goes by its own. So sore throat can become up like in ODPAR, like throat pain. Patient maybe come to you like a throat pain. When you take the history, totally goes to acute sore throat. So sore throat means throat pain, okay? Uncomfortable in your throat. So maybe they will give you like a throat pain and you get confused. Oh, how? Maybe people think it's a thyroid. No. They will not give you this station. I don't think so this station ever even come, but maybe the people really misdiagnose it. So patients usually come with sore throat, and you should go for history, like taking like a fever criteria, fever pain criteria. You need to follow central criteria and think about whether the patient need antibiotic or not. So you should remember this score. Why I'm stressing out on the criteria and the score, because I want you shouldn't miss. Sometimes people say, oh, my station was very good, but when your results come, you're fail. Why you're fail? Because you didn't explain very well. 50% history taking, 50% management plan. You need to explain the management plan very well. Elaborate, make it longer, explain more and more. Okay, guys. Now we are moving for the station number 1. We have right now Mr. Daniel, 35, male, who has brought to END abdominal pain for the last 2 days. He was given codeine 30 milligram orally for pain relief. Take a history from him, explain a management plan, and answer any question. he may have. So you can see that 35% and 65%, and this chart will be like that. The scenario will be given like this, and then you have to go for station. Who wants to practice? Anyone who wants to practice? I will act like a patient. You will be like history taker. Anyone?
I will.
Okay, that's great. Fantastic. So now I'm going to make it open this entire PPT. Wait 1 second, just okay, remember that this, when I just opened these slides with full complete dashboard, what will happen, this line will move up for 60 seconds, okay, and then the ring will be bell, you will hear the ring, then I will go for next slide. You will have 7 minutes inside in the station, and you can collect data management plan. We will practice total 8 minutes. In the exam, you will have total 9 minutes, including outside. Okay? Okay, so I'm going to make it basic. Sorry. Three, two, one, go. You have 1 minute to read.
Okay. Can I start early?
Think would be better. Okay. You want early?
Yes.
You will hear the ring the same like that.
Okay.
Yeah.
Hello, I'm Dr. Mariam. I'm the attending doctor in the emergency today, and I'll be taking your history, and I'll be doing examination. Can I please confirm your name and age?
Yeah,
What's your name?
I am Simon. I am 25.
Okay, very good. So, do you have someone with you, or are you alone?
I'm alone.
So I would ask my nurse to be chaperoned with me. Is that okay with you?
Okay.
Okay. Are you in any pain? Do you want some analgesia before we proceed? Do you want some painkillers?
No, I took a painkiller. I'm okay.
Okay. So I've heard that you had some abdominal pain, some tummy pain. Can you please explain what brought you to the emergency department today?
Yeah, doctor, problem. I have a pain in this, and like in my stomach. Last night I went with my friend, and we went to hang out, eat some food, and also we drank somewhere. And since then I came, the night was okay, but in the morning I wake up, I had a pain, and it's really pain.
Can you exactly tell me where? Can you exactly tell me where the pain is? Exactly pain point?
Yes, here in the middle of chest.
Is it going somewhere, or is it just at the middle of the chest?
No, not going anywhere. It's here, only here.
It starts.
Hello? Cannot hear you, please.
When exactly did it start?
Oh, it started in the morning.
Kind of pain is it? Is it?
It's like a burn inside, little bit, like I feel something burn inside. Hello?
And what makes it? What increases it? Is there something that increases the pain?
Oh, I drink coffee in the morning. Then I feel more bad.
And
think.
Is there something that decreases the pain? Taking any medicine?
I don't know. I didn't take. I just took one pain, paracetamol. I feel better a little bit.
And is it before the meal, mid meal, or after the meals?
I didn't took any meal since then. Last night I just took it. I was okay. Then in the morning I feel bad.
All right. Can you please tell me that did you have any vomiting? Did you feel nauseous, or any other thing with this pain?
Yes, doctor. When I spit something, I found some little blood, maybe little, very little blood in my vomit. Yeah, little blood in my vomit.
Was it red blood or were the clots?
I think it's a fresh, maybe, I would say.
Okay. Have you been experiencing any black colored stools?
No, I didn't check it.
Can you please tell me, are you taking any medicines, any medication currently?
No.
No medications. Have you? Do you have any other medical illness?
No.
All right. Can you please tell me what you do for a living?
Oh, I'm a computer programmer.
All right. And I'm sorry for the next question, but do you drink alcohol or are you into any illicit drugs?
Yes, sometimes I drink socially.
All right. And do you smoke?
Sometime with my friend when I go to pub.
All right. And do you does anyone in your family has a similar problem?
No.
All right. Do you have any questions to ask? And what are your concerns? Do you want to ask me anything?
No, I just don't know what's wrong with me. I just drank last night and I don't feel well.
You said that you vomited. How many times did you vomit?
Only one time.
That's it. And
Yeah.
there was pain in the tummy when you vomited.
No, pain is from long time, means since morning. Vomit time maybe a little later.
All right, all right. All right, given from the information that you've given me, I'd like to tell you that it seems to be that we'll have to conduct some investigations. I would conduct some blood tests, and I would also do some scans on you, just to confirm what the problem is. But what I feel the problem is, it is maybe you have some kind of an ulcer, or most probably an ulcer. But the test will confirm that. And meanwhile, I will also give you some medicines for your pain and also some medication for the vomiting that you had. And because you haven't had anything, so I will also give you some fluid via through your vein. Is that all right with you?
Okay.
Yeah, do you have any questions?
No, doctor. I just so how many days it will take to be fine?
Not long. The investigation that we will do, the test that we will do, will confirm it further, and then we will inform you of all the things that are happening along the course. You don't need to worry. You will be here with us in the ED, and once the results come back, we will guide you through everything.
Okay. Can I drink still coffee, or I should
No.
stop?
You have to change some of your practices. First of all, you will not have you will have to decrease the intake of the coffee and tea, because that is the most common culprit. Maybe you have an ulcer in your ulcer. Ulcer basically means a kind of a wound in your tummy, and that is what is causing blood in the vomit. And if you keep drinking alcohol or coffee or tea, it might aggravate the condition.
Time's
And
up.
another thing.
Thank you, Doctor. Your name I forget. Murray. Okay. Guys, could you please mute your mic, other guys? Okay, thank you. Okay, Dr. Mariam, your management plan I already simplified. What do you think? What I have? What could be the
ulcer? It was ulcer? Stomach ulcer?
It can be gastritis. It can be peptic ulcer. They both can be. Both are the cause of these can be what the most common cause of them. Could you please tell me?
Alcohol, caffeine, tea, and stress.
They increase this situation, but I mean the common cause is 97% H. pylori, right?
And H. pylori, yes. No.
Okay. So the management plan, you could say like that, the sore in your stomach. What? Sore in your stomach, not ulcer. make it simplified. Sore in your tummy, okay? So what I'm going to do, based on your information, first of all, you missed a lot of middle points. You systemic review, you forget it, okay? Did you take the systemic review? You just go from Socrates to directly to management.
Not enough time.
I think, okay. Anyway, systemic review is important. At least you should go with the relevant. If you miss the relevant is very, very important. You can miss some systems, no problem, but the relevant never need to miss. Relevant and miscellaneous, these two. Rest you can miss if 1 to 2 points, no problem, because you're gathering information correct, but the management plan is not good. So what you have to say, based on your information, the most likely problem you have sore in your stomach. What I'm going to do, I'm going to keep you in observation room. I will examine your tummy, and I will do some tests. That include full blood count, okay? And another test is special called urea breath test. I simplified for you is this one. In this test, what we do, you need to be fasting. We will give you 1 pill. After that, we will ask you to blow the balloon. And from there, we will do a test. And the most likely cause of your condition, can be most likely caused by a germ called H. pylori. So we will extract this H. pylori, this germ, from this balloon. If it's confirmed that, or you can say we have another choice inside of this test is called, we will collect some stool from you, we will do the test. If it's confirmed this, because I said I don't have any medication history, right? So it's not NSAID. So the most likely H. pylori. So what you will say, I will give you a treatment. There's a medication, antibiotics, 2 antibiotics, 1 to protect your stomach cold. You can verbalize the medicine, omeprazole, 20 milligram, antibiotic verbalize. You need to tell her amoxicillin, metronidazole for 7 to 10 days. After that, I will arrange, apart from that, I will arrange a follow-up with the gastroenterology. After 10 days, the gastroenterologist either pass a camera scan from your mouth to check out the ulcer heal or not. You need to tell all, and in my advice, I will give you a printed leaflet. The advice is that do not my advice is that do not consume the coffee or avoid taking caffeine, okay? And also avoid taking alcohol. These are the trigger for your stomach problem. Get it?
Yes, sir.
Yeah, this is a management plan. Regarding history taking, you need to go with the slide again. Okay, make sure that what you are going to ask, you need to completely ask these all questions. Okay, and the Socrates you didn't cover very well, so you need to cover again nicely. So I'm not going to stress out because we already stress out too much. So you just need to, next time when you will practice, you just make sure you practice with your colleague, it will be perfect. Okay, so let's move to our next slide. Are you ready, guys? Who want to practice? Anyone?
Yes, yeah.
Anyone can practice? Are you ready? Okay, that's
Yes.
great. Do not afraid, just try. Practice will make you perfect. Okay.
Okay, so can I start?
Okay.
Okay. Hi, my name is Dr. Zishan. I'm an emergency physician. May I know your name and age, please?
Yes, my name is Jason. I am 26.
Okay, Mr. Jason. May I know what brought you today?
Yeah, doctor, when I drink water, I feel pain here in my throat. It's like somebody banging my throat.
Oh, I'm so sorry to hear this. If you are in pain, may I give you any painkiller?
No, doctor, I took the painkiller. I'm okay now. For now.
Oh, okay, that's fine. Okay, let's proceed then. So could you tell me more about your pain, please?
Yeah, doctor, yesterday I went outside. It was very hot. I took coffee. Oh, sorry. Yeah, ice cold coffee, and the latte we say. And once I drink it, and soon after a couple of minutes, or I can say half an hour, I feel like some scratch in my throat.
So okay, so does this pain is gradual?
Excuse me?
Is
Pardon?
this pain does this pain start?
Yeah, the doctor is started suddenly.
Right. Is there any radiation? Does it goes and
No, doctor. It's here only in my throat.
okay? Is there any other symptoms?
I just feel little like hot. Maybe I feel like I maybe have a temperature.
Right. So what is it continuous, or does it occur with eating or swallowing?
Yes, doctor. When I swallow, I feel like a little bit stucking and more pain. Yeah.
Okay. Do you have anything which increases or worsen the pain?
Yeah, eating, drinking.
Okay. Does anything makes it better?
No idea. I don't know.
Right. So do you have any? You have you. What do you think that what you have?
I think maybe I have I got a cold.
Right. So do you have some concern about it?
No, I just want to know why I have this problem and how to settle.
Right. So what do you expect from me?
I just want to relieve this problem. That's why I came out.
Better. I just want to summarize that you have sore throat associated with the fever, and it increases when you are eating or drinking something. So let me review that. Do you throw up any vomiting, any bowel change, any abdominal pain associated with it?
No.
You have any change in the color of the urine or blood in the urine or urethral discharge?
No.
Any skin changes or rash?
No.
Okay. Any night sweat or any lump in the body or any weight loss?
I have swelling in my ear, in my throat nearby. I don't know what's that.
Well, okay. I will consider this. Okay. Do you have any chest pain or racing heart or dizziness?
No.
Okay. Any shortness of breath or cough or wheeze?
No.
Any headache or jerky movement or vision problem?
Yeah, a little bit headache, yeah, but no jerky movement.
Okay. Any weakness or numbness of the limb?
No.
Do you have any trauma?
No.
Okay, let me summarize again that you have sore throat associated with the fever and also headache associated with headache as well, and malaise. And do you have any medical condition also?
No.
Any drug allergy?
No.
Any problem, medical problem runs in your family?
No.
Okay, do you live alone or with family, with somebody?
I live with my fiance.
Okay, do you smoke or drink?
Sometimes.
Any recreational drink? Drugs?
No. No.
Okay, did you travel abroad recently?
No.
Are you working at the moment?
Yes.
Right. Do you have any questions? Do you have any further questions to me?
No.
Okay, to me, on the basis of the data I have collected, I found that you have sore in the throat, and I will confirm on my examination, but to me, there is sore throat, inflammation of the throat or the tonsil, and most likely it is a viral infection, tonsillitis, laryngitis. Sometime it may be bacterial. So I will treat you with mouthwash, analgesia, and some antibiotics. So is it clear so far to you?
Okay.
Do you have any questions?
No, thank you.
Thank you very much.
What do you think, Zishan? How you did it?
I missed the centaur score. In fact, because of the time restraint, I forgot to tell
That's the cause this affect your management plan.
Right,
Because yes, that's why I'm stressing out these screening tools. If you want to be a perfect, you should follow the screening tools. If you just want to just to memorize the notes, okay, I will refer to blah blah. I will start antibiotics. No, doesn't make sense. You need to mention we have a special criteria. We have a special scale. If I found that your score 0 to 1, I will send you home. But you see that I already told you that I have swelling. That's mentioned. I said swelling. There's swelling tones. It can be the lymph node. I said, and I also said about the temperature. So you can see how would be the score. And apart from that, you asking me cough, so no cough is already 3. Okay?
Right.
So you need to be very, very careful. Use these tools to give the management plan. So it's your first time. I think you did well, but you still need more and more practice. You're still missing many points. And you are adding medical terms. Avoid that. You will have 9 minutes.
Okay.
Believe me, you will have 9 minutes. When you come up the station, you will have still 1 minute left. Just practice more, you will go very quick, fast. I think total 8 minutes is enough to practice. Anyway, no problem. When you practice more, you will be all right. Next time, be careful. Okay, let's move to the next. Who can practice, guys? Anyone? Anyone, guys? Just try. If you do not practice, how it will go? Yes? Hello? Can you hear me, guys? Can you hear me?
Yes, I can hear you. I can hear you.
Okay, good. So anyone practice? No?
I will practice, Dr.
Okay, good. Very good. You can call me Dr. B, okay? Dr. B.
Okay.
Just make it short because once I came up here, I talked to the people and that's a little bit difficult for them to call me. So I just say to them, call me Dr. B is okay. So let's move to our next station we have. This one. It's a very easy station.
Okay. Should I start?
Okay.
Okay. Good morning. My name is Dr. Kashif. Can I have your name and date of birth, please?
Yes, my name is Joan. I am born 1998.
Okay. Can I ask you what comes for which reason you came to the emergency today?
Yes, doctor. I have a headache. I feel not very well after that. Then I moved to the hospital here, came here.
Okay. Can you tell me more about your headache?
Yeah, doctor, it started last night first. I had some episodes. It started like on my left side of head, and it's just like a kind of ringing, I could say, and I also feel like nausea sometimes. And I took a painkiller, paracetamol. It's a relief. Then again in the morning, again it started.
Okay. The onset of this pain was gradual, or it started instantaneously?
Doctor, is suddenly.
Okay. And can you describe the character of this pain? Like this headache is throbbing in nature and pressure-like headache, or what is the character of this pain? Headache.
I can say throbbing.
Okay. And it is continuous or intermittent?
It's last night was continuous. Yeah. Now also.
Okay. And it is radiating anywhere?
No.
Okay. Any factor that relieve this pain, this headache?
I think last night after headache, I was outside and in a pub. I was drinking. Then I came back home. I think I feel a bit better.
Okay. Okay. Any relieving factor?
The paracetamol I took it is last night. It was okay.
And if I ask you in a pain scale of from 1 to 10, and 1 being the less pain and 10 being the severe pain, how can you rate this pain?
I think 7.
7. Okay. Okay. Should I give you some painkiller right now? How you are feeling now?
I still have pain, but it's okay.
Okay. Is there any previous? Do you have previous medical conditions?
No.
Any previous admissions or with some similar complaints of headache previously?
I don't think so like that.
Any previous surgeries?
No.
Okay. And any recent traveling?
No.
Any family history of this headache problems in your family?
Yeah, my mother has similar problem. She also have this headache.
Yeah. Are you working?
No, I'm working. I'm a computer programmer.
Okay. Where do you live? And whom do you live with?
I live in city center with my family.
Okay. I am sorry to ask one question, one personal question. Do you smoke?
Sometimes when I go pub.
Okay. And another question, do you drink alcohol on regular basis?
Socially? Any events?
Okay, not on regular basis. Okay. And
yes.
Okay. And anything do you want to add more?
No. I don't know what's going on.
And lastly, what do you think regarding this pain? What is the cause of this pain? What do you think?
Maybe my mother has, maybe I have the same problem.
Okay. Any special concern regarding this pain?
I'm worried, doctor. I don't want to have this pain because I see my mother is always, she feel very problem, is always have headache.
From this consultation today? Okay, okay, sorry. What do you expect from us today?
I want to know what's going on and treat this problem.
It's called migraine that runs in the family. Yes.
Okay.
Most likely you have having a migraine and that runs in families also, and that is precipitated by some trigger factors like intake of alcohol, intake of chocolates, and this stressful day or something like that. I will admit you in the observation. I will get some blood tests for you like CBC, biochemistry, and VBGs, and I will give you painkiller, and after that we will see how you respond. And I will give you also oral sumatriptan, and if you will feel better, then I will discharge you with, and I will arrange a follow-up with the neurology clinic in future. And if your pain doesn't settles, or then I will call the neurologist for you for the further management plan. Are you okay with my? Have you understand my management plan?
Okay.
Okay. Are you agree with it?
Okay.
Anything? Any question you have to ask?
No.
Okay. Thank you so much.
Okay, you still have a few seconds, but I will not go for the history taking because you already have slides, so you next time to check out, practice more and more, you will be, practice will make you perfect to see all, because everything is already written there, so you just need to follow that. Regarding your management plan, why you want to refer me to neurologist? You can, why do you need even blood test for that? If you make a diagnosis of migraine and it's clearly visible, my family history told you, and you can say, keep you in observation, and then I will give you a painkiller and I will safety net. You need to advise me, like you need to do exercise, you need to avoid stressful, what else you need to aid it in migraine, avoid from the trigger factors as like we discussed. So why you want to refer me to neurologist? You can discharge me without.
Can I ask you a question?
Yeah.
Can I ask you a question?
Yes.
So, I was asking that what should we use for migraine as a common layman term, like just headache or just something?
Pardon? Could you please say it again and loud, a little bit close to your mic?
I am asking that what should we use for migraine as a common layman term to explain for the patients?
The migraine is very, very common. So everyone is itself in as English words we say. You just say the simple, this is word migraine. It's everyone knows it. In UK, you just say the migraine, they will understand everything. There's no specific word for that. Yeah, it's a type of headache. So yeah. So I was talking about the management plan, guys. The management plan is given by NICE guideline. Follow it. Okay. Don't need referral to neurologist. Don't need referral to because nice guideline make it everything clear. And next time I will try to send you the management plan. I will try to put the slides that you should know exactly the management plan. Just need to explain in your own word, but everything will be follow nice guideline. You don't need to.
So can we? Yeah.
Continue. Yes, sir.
Yeah. So actually, we can start with the reassurance, and then we can ask the patient that you can reduce your screen time, which you were asked in the history. You had screen time that can cause migraine too. So we can give him advice regarding that lifestyle changes.
You're talking about what? Excuse me, I cannot hear you. I don't know why. Maybe my network is not very good. Yeah, could you please say it again?
Okay. So can you hear me right now?
Yes, yes.
Yeah. So, sir, actually, he was asking you regarding the history, that where do you work, and you said that I work in front of the screen, right?
Yeah, computer programmer. I said yes. You can say yes. Yes,
so he
you're
can
right.
advise. Yeah, he can.
Yes.
Yeah, he can advise that reduce the screen timing.
Yes, that's correct. That's what I want to stress out. Whenever you give the management plan, please follow nice guideline. Don't follow what's going on in your country the way you do. Don't. Because you're an ED physician, if you refer all patient to them, so why you are an ED? Okay. A patient came to you serious, you just give the printed. Oh, yes, that's you can do. Follow up with the GP. What? Follow up with GP. Okay. Who was the Zishan, right? Zishan was here, right? Okay, Mr. Zishan, you can say the follow up with your GP. Okay. Because these are a common condition which can be done by the GP. Maybe the patient came to ED because he was severe in condition, waiting for, because in UK, GP appointment, maybe people get in 2 weeks, 3 weeks. ED usually minimum time, waiting time is 2.5 hours. Sometimes even 8 hours, but it's still the same day, right? Hello? Okay. Okay, anyone, any other one, any other candidates who want to practice? One more thing. Yes, just 1 second.
So,
do not interrupt the patient when patient is talking, okay? Do you hear me, guys? Do not interrupt the patient when patient is telling you complaint. Do not be hurry. You need to listen to the patient, okay? Once he finished, then you tell whatever you say. Yes, please. Anyone, someone asked me a question, yeah? Excuse me?
we are taking the history or not?
Yes, we
Yes,
have
can
one
we
more.
can we have a paper and pen with us?
Of course, if you note it, it's very good. If you do not note it, I already put the slide, you can follow. Or if you need a management plan, I can send you later. Okay? Or you can just, what I verbalize, you can note it. Okay? Anyone to practice? Next station. Hello? Anyone to practice? Or the same candidates can practice if they wish to.
Yes, I want to practice.
Okay, that's great.
I want to practice.
Okay, this is the station.
Can I start?
Yes.
Hello, I am Dr. Ramona, emergency registrar. May I know your name and age, please?
Yes, my name is James. I'm 27.
Nice to meet you again. Please, can you tell me how can I help you today?
Yes, doctor. I don't know. I'm very young, but I feel pain on this side and in my left. I don't know how is it started, but I don't feel good.
I am sorry to hear that. Are you now in pain? I can offer you analgesia.
Dear, I got the pain and it just came in ED, and one here was, I think, maybe nurse. She gave me.
Please nurse offer her paracetamol 1 gram. Are you comfortable now?
Yeah, I'm better.
I need to ask you some questions. Is it okay for you?
Yes, yes.
You said that you have chest pain. Can you please localize your chest pain?
Yeah, it's here on my little bit left. And yeah, it's a little bit severe, I think.
I need to shift my patient to resuscitation area and connect him to monitor and do for him heart racing.
Okay.
Please, can you tell me this pain is of sudden onset or gradual?
I think gradual. I think gradual. Before it has a little bit, then it's increased a little now.
You feel this pain like sharp, like stabbing, like heaviness?
I can say a kind of sharp, maybe. A kind of sharp.
This pain in your chest, is it going anywhere? To your shoulder, to your jaw?
I just sometimes a little bit feel on my shoulder, maybe. I feel uncomfortable, but not really.
Anything make your pain improve?
Yeah, when I sit down, I feel better.
Anything make your pain get worse?
Last night I found I just go to the bed and I feel like something wrong with my breathing. I feel that.
By any chance, can you score your pain on pain scale to 10, 10 being the worst?
Maybe 6, maybe 5.
You have any heart racing?
No, no.
You have dizziness?
No.
You have any shortness of breath?
No.
Any cough?
No.
You have feel sick? You feel
before a few days, I still feel like maybe I have problem. I have running nose like that. But just nothing then more than that.
Sorry for that. You throw out?
No.
You have any change in your bowel movement?
No.
You have any change in your urine?
No.
Any skin changes?
No.
Any fever?
No.
Any weight loss?
No.
Any lump in your body?
No.
Any headache?
No.
Vision problem?
No.
Weakness?
No.
And history of trauma?
No.
Let me summarize what you said to me. You said that you have central chest pain, this pain like heaviness, and this pain is radiating to your shoulder, and it got worse. Is it okay? What I said?
It's get maybe breathing problem when I go to bed. Yeah, it's like lay down.
Oh, okay. You have any problem?
What? Pardon?
You have any past history of similar condition?
No.
Medication or any illness?
No.
You have any family history of similar condition?
No.
You are taking?
No.
No, you are not taking medication. You have any drug allergy?
Oh, no any allergy.
I will shift you to observation. So I will shift you to station area. I will general examination.
Okay. Hello.
Most probably you have most probably some problem in your heart. It could be due to some infarction or I need to rule out other causes. I will call for you cardiologist. I will give you oxygen. I will give you some anesthesia. And I will give you a blood thinner like aspirin, clopidogrel. Is it my plan clear for you?
Okay.
You need me to add anything?
No.
Thank you.
What do you think, guys? What could be the diagnosis and treatment? Anyone can tell me the treatment to the point.
This is mostly non-cardiac cause of pleuritic chest pain.
Yes, one. Good. And the diagnosis would be likely?
Pneumothorax.
Somebody said something just now. Where? Again? I said the pain. No, I said the pain when I go to the bed is getting worsening. I mean, acute pericarditis. Yes. I said running nose. I have a sore throat too. So it's acute pericarditis. Why? And I don't have temperature. Why do you want to refer me to cardiologist, guys? Just give me NSAID and discharge me. Yes, just discharge me with parental leaflet. If it is getting worsening, follow up with the cardiologist. Parental leaflet, that's it. Don't need to think too much about that. Okay.
Yes, non-steroidal.
And don't need like research room. You still know you didn't arrive. What is the cause? These pericarditis really need a research room now. Okay. So sometimes people aid. Okay, if chest pain, yes, good to go for research. I also aid this history taking in the first lecture, which I went to webinar. I aid such a way history, but then I changed to another one because I want to give you both track that you can choose by yourself. Don't make any mistakes. Still now you are not diagnosed. You are going to likely diagnose. Research room maybe not needed. Acute pericarditis don't need a research room. Okay, you can safely discharge this patient with parental leaflet with advice.
Yeah, we can go for the ECG and then we can check the symptoms and then we can judge you.
Yes, I already told you I don't have fever. I don't have anything. I just have a little problem. And I said I have a running nose. That's mean pericarditis. Go home by like that. Okay, good. Very good. You did everything. Almost you cover many things. Yes, guys, you need to cover history very well. Don't lose. You must go systemic review. Many candidates are missing the systemic review. Don't miss that. Try to cover everything. Start with the most relevant. And don't forget to empathy. Many candidates are forgetting empathy, like you don't say, I'm sorry to hear that. Then you ask him again, can you please tell me more about that? You guys are forgetting. When you ask more about that, I can more clarify to you. First complaint may be short. The second will be longer. Then you will get the diagnosis very well. Okay, that's great.
Can I ask you a question, sir? So can I ask you a question?
Yes, you can ask me.
Sir, so when we are practicing the history, should we practice it from a source or should we practice it just like from our memory?
Okay. You know, normally what we practice in the hospital all around the world, when you come up to the NHS system, you will do the same way. But the problem is that for the medical exam, you need to follow these steps. Okay. For the purpose of exam, you need to go these steps I already given in this. In this steps, you should follow the steps, that one, but you can verbalize in your own word, no problem. don't need to follow exactly what is written. If you follow that,
Okay.
good. If you verbalize in your own words, that's also good.
Sir,
Okay.
can the sequence be changed a bit because in memory there's a little distortion. We can go from word to word.
That's what I said. Practice and practice make you perfect. Of course,
Okay,
this is your first webinar. Of course, you will have many problems like upside down. But if you continue practice, everything will be perfect. Don't worry. Okay, it's normal. You guys are totally normal. Yeah.
And we can take notes while taking the history. We can have a pen and paper with us.
Yes, normal. Do you know when I was preparing exam, I didn't have any notes. What I was doing, I need to collect information. I need to write down. But for you guys, you say I give you the slides, this all how to take history steps. Now you need to just apply. And another, why I said you guys to prepare for management plan, because management plan is very important. I see everyone practice like, okay, refer to cardiologist. Okay, refer to neurologist. If we need to refer this patient, so why we are ED physician? So you need to be very careful. Yes.
Yeah, sir, can we use the notes there, the patient's history? Can we write down the
from the which we are recording this video tutorial you are talking about
in OSCE?
You mean in
no,
the real
I'm
time?
talking about the exam.
Real time exam. How would you write down the notes? How can you write down the notes?
Can we write whatever the patient is saying, so it gets easier to give the management plan?
You mean to note the patient, what is patient saying, and then you give management. Oh no, in London diet. I give the last in previous webinar. I said you guys is in Malaysia diet. They give the pencil, paper, and also the table between. What I heard from the candidate. In London, you will sit like the ways you see in this picture, exactly the same. Does she has any pen or anything in her hand? No, you will not have any pen or any paper, but what you will do, when some station, when you go wrong, maybe examiner will help you to read the notes again. Inside have notes. Got it, guys? But you cannot write down. And when you taking history, when you're explaining anything, you need to look at the patient face, not at your notes. This is also it will be considered wrong way if you. And next, another important thing: do not present chaperone every time. Is it okay a nurse attend with as a chaperone? Why do you need a nurse? You don't need some special station, female or the male, like is relevant to urogenital system. Rest of don't need a chaperone. Just ignore it. Even you don't need to wash your hands to verbalize in the station. I wash my hands. You are here history taking. Don't need. They don't care about that. The careness is that they will care about your hands, gloves, everything when you are going to do a skill, practical skills. That means you're going for the oropharyngeal airway or the resuscitation. In that situation, you can go for that. But normally history taking or anything like that, breaking bad news is useless to even. There is always the sanitizer. You don't need to all the time go and sanitize your hand. Sometimes you can have itching, right? So not every station needed, and they can tell you. I think the Royal College usually tell the people when you're in a, before go for a station, they give you a briefing. Don't need to wash your hands all the time. Don't need to ask gloves. You don't need. Okay, clear so far, guys?
So excuse me.
Yes, sir.
Okay,
so about
let's go. Let's go for the station, guys. We have a lot of station, 3-4 more. Okay. Anyone want to practice? Then in the end, I will give you a session of questioning. Okay. You can write it down. Okay. Anyone to practice, guys?
Yes, I will practice.
Okay, good. Very good. We are moving to next station. Yeah. It's very easy. We already discussed.
Oh, can I start, please?
Okay.
Okay. Hello. Good morning. My name is Mohammed Zishan. I am emergency physician. May I know your name and age, please?
Yes, I am James, 27.
Okay, James. Nice to meet you. What brought you here today, please? Could you tell me?
Oh, doctor, it's severe pain on my back. I don't know. I don't know what's wrong with me.
Oh, I'm sorry to hear about it. So who is with you? I think your wife is with you. Can you call her with you here?
Okay.
Thank you. So could you tell me more about your, before we move ahead, can you tell me if it is hurting so that I can give you pain relief so it will help you to relieve the pain? Is it okay?
Oh yeah, I came here. Someone gave me the painkiller. Now I feel better than before.
Okay, that's good to hear. Okay, so I will move ahead. Could you tell me more about the pain?
Yeah, doctor is started last night. I just finished my work, and is I don't know. I just bent down. I hold on some stuff in my work, and then since then I got a severe pain, and now it's going in my leg and this one in my right leg. Oh, it's really hurting.
Right. So it happened suddenly, right? It looks like.
Yeah. After that stuff, I hold on.
So how do you describe your pain?
Oh, doctor, it's really severe.
Okay. About the pain score from 0 to 10. 0 is the minimal and 10 is the maximum. Could you please rate it?
I can say 8.
Oh, it's quite severe, I think. Sorry again. So does it radiate anywhere? As you said, it radiates to the right leg, somewhere else.
Yeah, in my leg, in the back of the front to store and go in just like in my calf as well. It's like.
Okay, so is there any thing associated with it, like any other symptom?
No, I just feel pain. I cannot sit down, can't bow down as well.
Do you have any numbness with it?
No.
Oh.
Hello?
Hello?
Yeah, hear you.
Oh. It was?
No, I don't have idea.
Something relieves?
I took the painkiller. Yeah, it's make a bit better.
So, what do you think? What caused your symptom?
Oh, maybe I stand a long time or work a lot.
Also.
Uh,
Okay. Do you have any expectation from our ED?
Yeah, doctor, what you will do now, I don't know how to be comfortable.
Okay. Do you have any headache, any neurological symptom, any jerky movements, any numbness, any loss of consciousness?
No.
Right. Any chest pain? Any
No.
shortness of breath?
No.
Okay. Any cough?
No.
Any heart racing?
No.
Any skin rash?
No.
Any fever, night sweat? weight loss,
No.
any urinary symptoms,
No.
any nausea, any throw up, any abdominal, any tummy pain,
No.
any loose stool,
No.
any weakness of the body.
Doctor, you asked me 3 times. No.
Okay, so let me summarize. You have the back pain, which is radiated to the limb, and no any other systemic illness. Do you have any medical condition?
No.
Are you taking any regular medication?
No.
Do you have any allergy to it?
No.
Any medical problem which run in your family?
No.
Okay. Okay, where do you live and whom do you live with?
City center with my fiance.
Okay. Can I ask some personal question if you don't mind?
Okay.
Do you smoke or drink alcohol?
Sometimes.
Any recreational drugs?
No.
Any history of traveling recently?
No.
Okay. Are you working at the moment?
Yeah. I'm a
Okay.
computer programmer.
That's wonderful. So, do you have any questions
No.
related to this problem? Okay. Thank you for your information. Based on your data, I would like to make some diagnosis, differential diagnosis, which makes me that you have back pain, which is sciatica, called sciatica, and which is neurological problem associated with the long-standing or some compression of the nerve, which radiates to the limb, either of the limbs. So in this case, we will do some examination, some investigation, and some X-rays of the spine, which is called the MRI. So it will help you it will help us to find out the reason, and after that we will discharge you with some painkillers and with the physiotherapy your appointment, and with the follow-up with the GP surgery. So do you have any other further concern?
No.
Would you like to ask? Okay,
Time's
thank
up.
you very much. Thank you.
Your name is Zishan, right?
Yes, sir.
Okay. Dr. Zishan, you told everything in medical term.
Oh my God.
You haven't simplified, and your management plan is very simple sciatica pain. Just discharge with the painkiller and advise. That's it. Okay. This patient said, "Oh, I took some stuff, and since then I feel pain." Of course, sciatica always severe. So what you need to say, according to your information or based on your information, which I collected from you, the most likely problem in your back is due to a bone, or you can say there is a disc in between your backbones is displaced from its normal position and it's compressing the nerve which is going in your leg. Just make simple. So what I'm going to do, I'm going to give you I examine. First, you say I will examine your nerves, okay, especially your legs, and then I will give you a painkiller. Don't need image, okay? Painkiller. Ibuprofen, you say 600, 800 milligram. What else? According to severity. And I will give you a printed leaflet. There will be advice. Advice is that you go ahead with the work. Do not stop the working. Do not take the bed rest. These are all things you need to aid, okay? And apart from that, I will refer you to physiotherapy to help you with that. And I will arrange a follow-up with the GP if you want to aid. Just aid it. Nothing need to explain this whole thing. Oh my gosh, I don't know, do MRI, this is very, very simple. Just make it simple, unless it's a complicated with the red flags, which is nice guideline gives, like neurological deficit, etc. Then you have to go for MRI. It's clear so far, guys, for everyone. And another things,
thank you very much, sir.
Another thing is that you are not trying to exploring the complaint very well. Follow Socrates normally. Each and every, it will make it, once you will practice, take the photo in your phone, first of all. I know that you cannot share the screenshot, or you cannot take even a screenshot. What you can do with mobile, take photo from Telegram, and then write down on the paper if you want, or to practice, you can just check on mobile and practice here with me. You can do that. Okay. Okay, so the management plan, I try to correct you. Rest of things I already gave you. You need to be very careful. Just need to, what is written, if you cannot make your own word, follow that one. That's it. Very simple. And important, you need to be careful. Make the priority of the system which is relevant. This is back pain, so relevant is the musculoskeletal. Okay. Any numbness, weakness, avoid, repeat the same question. Do not repeat again and again. Okay. Anyone?
Sir, about the timing, about the clock, is it appearing there?
No. This is clock, which I showed here in the screen, right? I just want to make sure that you don't feel like that I close it early. Just for that. Because I want to make you under time pressure. And I want you to see how you control your pressure, how you do everything. That you get use of it. Okay?
Thank you. So there's
anyone?
any ringing tone which will show us that only
sure.
the last minute?
Sure. No ringing about short. Your time's up, ring will be bell. The same way. Same like here. I'm not doing here because we are just quickly moving. Otherwise, you can hear this ring. Okay, another one.
No. So one last question. I heard that in India.
I will answer you all the question in the end. Let's finish this session. Okay.
Thank you.
Anyone to practice? Anyone to practice, guys?
I
okay.
will.
That's okay. Thank you. Go for it.
Start.
Okay.
Hello, I'm Dr. MRCEM, and I'll be the ED doctor today. Can I please confirm your name and identity and age?
Yeah, I'm James, 28.
Nice to meet you. So what has brought you to the ED today? What happened?
Doctor, I don't know. I had severe pain in my place. I feel very terrible.
Oh, I'm really sorry to hear that. Do you want someone to be with you while I take the history? Do you have someone with you right now, or are you alone?
I'm okay. I'm alone.
Okay, then I would like I will have a nurse with me to chaperone. Is that okay with you?
Okay.
Okay, can you please tell me more about the pain exactly? Can you please elaborate?
Yeah, it's just started. I was walking around. I just take the tube to go home, and I just sat down on the tube, and suddenly this pain started. And I just get off the train and came up here in ED.
Around 1 hour back?
No, 30 minutes.
Okay, and exactly, can you pinpoint the site of pain?
Yeah, doctor is here on my left side. He's in our left testis.
Okay, and can you describe the pain for me?
Oh, it's very sharp. I even cannot sit down.
Okay. Is it going anywhere?
No.
Okay, do you have any other symptom with it? Like, do you have vomiting or anything else that you're feeling along with it?
I feel something wrong with my tummy. I feel
All
not good.
right.
Yeah.
Okay, okay. And is the pain continuous or does it stop and comes and goes?
It's continuous.
Continuous. And does something makes it worse?
And I don't feel anything since then. Pain is just worsening and worsening.
Does something makes it better?
No idea.
Can you please rank it in severity from 1 to 10?
8.
Okay, that's pretty bad. Sorry, it did not offer you analgesia. Would you like to have some analgesia? Are you in pain?
How
Can I
did
give you
when
some?
I came up on the bay, the girl, she, I think the blue coat she gave me.
Okay, okay. So, what do you think is causing your pain?
I don't know, doctor. It's first time. It's very, very strange.
Are you worried about something?
No, just my
Okay, and
pain.
what? Okay, okay. And what are you expecting? Are there any specific expectation that you have over here?
Doctor, I want to be fine soon.
Okay, don't worry. We'll take care of you. I would like to know that do you have any nausea, vomiting? Are you feeling sick? Do you have any diarrhea?
No, no,
Any tummy pain along with this pain?
no. Tummy upset. Yeah, I shaked.
All right. Do you have any change in urine color or any
No,
problem with urinating?
no, I didn't go to any toilet since then.
Do you have any discharge from your private parts?
No,
Okay. Have you experienced any skin changes, any rash?
no,
Okay. Do you feel that you are
pardon?
do you feel that you have fever, temperature?
No,
Okay. Do you have any palpitations? Any headaches?
no.
Okay. Torsion, it's basically testes sometimes turn over themselves, and it is a kind of a surgical emergency for us. What I will do is examine you, and I will have a chaperone with me for that. And after examination, we will also conduct some tests and ultrasound, because
Okay.
if it turns out to be testicular torsion, which means that your testes have twisted upon themselves, then I will have to refer you to surgery. But before that, I will give you some. First of all, I will do a maneuver in which I will try to pull your testes downward, and it might untwist on itself, but it's not very common for it to untwist on itself on its own. But still, we will give it a try, and I will give you an analgesia, and if you are feeling nauseous, then I will also give you medicine which will make you feel better. And can you please tell me about are you taking any drugs?
No,
Are you on any medication?
no,
Has anyone in your family ever had this problem?
no,
Okay. And do you live alone or with
no,
someone?
no, alone.
Okay, I'm sorry for the next question, but do you drink alcohol or do you smoke or doing any drugs?
No,
Okay, okay. Do you have any questions?
no.
No? All right. So most probably it is a testicular torsion, but as I told you that we will conduct ultrasound. That is an investigation for you, and we will also take your blood for some tests. And if it turns out to be testicular torsion, then I will have to refer you to surgery, because we will have to do the surgery as soon as possible within 24 hours. And in that surgery, the testes will be untwisted from its place, and it will be uh, It's a small surgery, but you don't need to worry about it. But the exact cause will be determined after examination. Anything else that you would like to know?
You will do ultrasound before the surgery or the after examining?
Before this, after examining. I'll do the ultrasound after examination.
Okay, time's up. Overall, you do well, but you were not concise. You need to take all the history before you put the management plan. Okay, number one. Number two is the time for this is 6 hours. Okay, you should do it in 6 hours. After that is not successful. Usually the dormant, it goes dormant. So what you have to do, you said I will do the diagnose, you do. So what you say, the turnover or twist, yeah, that's very good. You said you didn't follow the medical term. Okay, very good. And then you say keep your observation. I will do the examination around your private part genital area. You can say I will check for any rashes, and if the examination confirm that it's the testicle, your testis twist around itself, I will immediately refer you to surgery without going through the ultrasounds. Get it? Because you do ultrasound, you are going to waste your time, and also a patient can be in typical situation. So if the examination confirms a clinical diagnosis, just go for surgery. Okay. If the examination came up normal, then you say, I will do ultrasound. If I found any abnormality, I will refer you to there. Okay. Clear so far?
Yes, sir. Thank you.
So the examination, just and make it simpler. Yeah, you did very simple. You should say, I will give you painkiller. Another thing, you were not concise. As I said, you need to just make sure that next time ask all the history, but you can summarize it before management plan. Great. Somebody draw a line. I'm not very good at it. I don't know how to remove it. And if anyone can remove it, please remove it. Okay. Okay. So anyone want to practice? Yes. Or you bet? Okay, that's good. If you want to have a break, I can do it, but I think don't have too much station. We are very, very close. If you want to break, we can arrange a break now. Or continue.
Dr. B, I will practice.
Okay, that's great. So let's move. Yeah.
Good morning. I am Dr. Kashif. Can I have your name and age, please?
Yeah, I am Joan. I am 28.
Okay. Nice to meet you. Can I ask how do you come to the emergency today?
Yeah, doctor, this is a pelvic pain, should be lady, right? I'm Miss Lauren, sorry. Lauren, 28. Yeah, doctor, I have a pain in here in my lower part of tummy.
Okay. Are you right now?
I'm okay.
Okay. Can you tell me more about your pelvic pain?
Doctor is he started 2 days ago. It was not that much, and now it's worsening.
Okay. Okay. The onset of pain was gradual or sudden?
It's gradual.
What is the character of this pain? Like this is burning, stabbing, or pricking like pain?
Yeah, it's kind of stabbing.
Does this pain radiate?
No. I think you.
Okay. And any associated factors like nausea, vomiting, any other problem, any discharge?
Yeah, the last night I was nauseous and also twice vomit.
Okay, okay. Sorry to hear that. Anything that increases this pain?
No idea.
Okay. Anything that relieves this pain?
Sometimes I sit and take painkiller, maybe paracetamol.
Okay. In a pain scale of from 1 to 10, the 10 being the worst pain, how can you rate your pain?
Maybe 8. Oh, sorry, 6.
Okay, sorry to hear that. And I will ask some more questions with you, and you can answer me in quick yes or no. When your last periods came?
I think 15 days ago.
15 days ago. Okay. And one personal question I want to ask with you: are you in any relationship?
No, I have a boyfriend.
Okay. And the other thing, any abdominal pain you have? You feel any abdominal pain?
Yeah, doctor, I said it's in my lower part of abdomen.
Okay, sorry. And any do you feel heart racing?
No.
Any pain in your thighs?
No.
Okay. Okay. Any constipation?
No.
No. Okay. And I will ask some personal question with you. Where do you live and whom you live with?
I live in city center with my boyfriend.
Okay. And do you smoke?
No.
Do you take alcohol?
Yeah, sometime socially.
By any chance, any use of recreational drugs?
No.
Are you working?
Yeah.
Okay. Any significant family history of such problems in your mother or sister?
No.
Pelvic pain or something?
No.
Okay. And can I have you one more personal question? When you had, did you have any sexual intercourse with your boyfriend?
Yeah.
No. Okay.
Yes,
And
yes. I
yes.
said yes.
Okay. Okay. Can I ask how many days ago?
I think 10 days ago.
Okay. Okay. Thank you. And what do you feel that this pain is? What is the cause of this pain? Any idea?
Maybe I have infection.
Okay. And any specific concerns regarding this pain?
This pain is here. I maybe worry about, am I pregnant or maybe infection? I don't know.
Okay. And what do you expect from today's consultation and this consultation?
I want to be better.
Okay. From the data I have gathered from you, you have pelvic pain. There may be many causes of this pelvic pain. I will shift to the observation. I will examine your tummy, and I will do some blood test, including beta HCG and urine complete, and I will also ask for the transvaginal ultrasound to look for the this ectopic pregnancy or And if we find that it turns out to be ectopic pregnancy, then I will immediately refer you to the gynecologist. And if the beta HCG is negative and all the tests turns out to be negative, then we will do some further testing, and we will do some X-rays and try to find out the other causes. Are you agree with my plan?
Okay.
Any other question you want to ask?
No.
Thank you.
Dr. Kashif, okay, I said I had a menstruation period. You asked me, I should have 15 days ago. Why do you think ectopic pregnancy? Can you hear me, guys?
Yes. Okay.
So you should rule out, think about PID. Okay. You didn't ask me the temperature. You didn't ask me any lump, any wet loss, anything. Okay. If you ask me, maybe I should say, yes, I have temperature yesterday. Low grade. Can I say? So you can reach the diagnosis. I want to make it PID, but you went ectopic. And even though I told you I had a menstruation 15 days ago, in the history taking, I didn't aid the menstruation. So guys, in systemic review, in the end of the systemic review, you should ask the menstruation, any female present with the pelvic pain, okay? You should ask after systemic review. And systemic review wasn't concise. You use a lot of medical term. Why you said transvaginal examination, or the ultrasound? Patient maybe do not understand your ultrasound. You should say, we will do the examination of your private portal vagina. We will also do a scan inside to check for any worm or any the fetus, like as I'm suspecting the ectopic pregnancy. You should say like that. You do not use the medical terms, okay? Be careful with that.
Okay.
Okay. And the PID treatment, if confirm, if ectopic confirm, you will refer this patient to gynecology specialty. But you will tell her there are two kind of ways to treat this one. Number one, the medical treatment. The gynecologist, the doctor or female, will give you the medicine which will help you to expel the production or product of conception or the fetus. Another is surgical, to remove it. So I'm going to refer you to gynecologist. This way you need to explain to her. Clear so far? If the PID, then you'll say, I'm coming to the treatment. I will give you the antibiotics for 14 days, 3 types. One I will give you now is ceftriaxone in your muscle. 2, I will give you orally. You can take this for 14 days. And also, I'm going to refer you to genitourinary clinic for follow-up. You will be follow-up. And you'll ask her, where is your boyfriend? He needs to be followed up with genitourinary clinic. If he has any symptoms, means you will go for contact tracing. Clear so far?
Yes, thank you.
Okay. Yeah, this way you need to explain everything. Then you will get the good score. If you just go over, use medical terms, no. You did everything even you do perfect from 1 to 0 to 100. They will not give you a score if you use medical terms. They already mentioned that avoid jargon. So don't do this kind of thing. Make simplify everything as much as you can. Just simplify it in your own words. Okay. Anyone to practice, guys?
Yes.
Okay, that's great. I think I have the real gem in my webinar. Okay. This one, knee pain.
Okay.
Ready?
Yes. Okay. This is the hello. Good morning. This is Dr. Dishan. May I know your name and age, please?
Yeah, I am June, 37.
Okay, Mr. John. Nice to meet you. What brought you here, Mr. J?
Yeah, I had a knee pain. I don't know.
Sorry to hear about it. Are you in pain now?
When I came up on the bay, a nurse gave me the painkiller.
Right, that's good. So I hope you are feeling comfortable now.
I'm okay.
Okay, so let me proceed. Could you please tell me more about your pain?
It's a stoltate. 2 days. 2 days I play a game with my friend, and then I came back. I just feel really terrible in my leg. And before I also had, but not really bad. This time is really worse.
Okay, so it happened to you in the past as well, right?
Yeah, I can tell you.
Okay, so does this pain, this one happen suddenly?
I think yes, this time, not suddenly. I said I had a past, but not that much worse. And it's like that.
Okay.
Not
Okay.
only today.
Right. So what is the character would you like to describe?
It's a little bit, I cannot explain. It's not really a severe pain, but it is a pain when I walk. And
Okay, so it's dull light. So
yeah.
any radiation you have?
No.
Does it go? So it's not going. Any other symptom which comes up with your knee pain?
Yeah, doctor, I see in my fingers too, the swelling, same like this. It also is a pain.
So there is no calf pain or leg pain associated?
No.
Okay, is it continuous or it comes and goes?
It's always continuous, but this time is a lot than before.
Okay, anything which make it worse?
Hey, in the morning especially, it works a long time.
So how does it improve?
When I walk around working, maybe on all day, I even don't know what's going on, but sometimes I just feel, yeah.
So how do you rate your pain from 1 to 10?
Maybe 5.
Okay. So do you have any idea what is the cause of?
I don't know. I really don't know. Hello?
Okay, so are you worried about something peculiar?
Yeah, my dad has the same problem. I'm worried maybe I have the same problem.
Okay, so what is your expectation being in the ER, in the emergency department?
I wish I could get fine soon.
I wish too. So would you please tell me about do you have any weakness or numbness or trauma, recent trauma?
No.
Okay, so any headache, visual problem, any loss of consciousness?
I think maybe I have a problem with my eyes. Sometimes I have some blur vision in my eyes. Yeah.
Okay. So do you throw up, or do you have tummy pain or any bowel changes?
Not really.
Any urine problem or any urethral discharge?
No, no.
Any rash or skin changes?
No.
And does this pain link with your fever, like high temperature, night sweat,
No.
weight loss? Any chest pain or heart racing, dizziness?
No.
Any shortness of breath, please?
No.
Okay, so I would like to summarize. You have the knee pain, which was gradual in onset. It happened in the past as well. And you have the family history as well. So do you have drug allergy? Any regular
No.
medication? Any medical condition?
I take the painkiller for this pain.
Right. Okay. Do you smoke or drink?
Before now, I don't.
Right. Okay. So do you have any question?
No.
Okay. Based on this, I have actually differential diagnosis that it may be gout, which is because of the high uric acid content, or it could be it could be rheumatoid arthritis also. So in this case, we will proceed with some lab tests, some antigen tests, blood tests will show up this one, including uric acid and some antigen tests. And on this basis, I will discharge you with the painkiller ibuprofen and with the GP follow-up. Hope it will solve your problem. Do you have any concern?
No.
Okay, thank you, dear. Okay, have a nice day. See you.
Thank you. What do you think, guys? What could be the diagnosis? Everyone.
Rheumatoid arthritis.
Yeah, that's very simple. Rheumatoid arthritis. So you need to refer to me, or at least to follow a rheumatologist. Okay.
Okay.
Do you get my point?
Yes, yes.
Yeah. So how would you say in simple words? Anybody can tell me in simple words how you will say based on your information. Simple words. Rheumatoid arthritis, osteoarthritis, gout. These all are what?
It is inflammatory disease.
Yeah, just say it is. I'm suspecting an inflammation in your knee. It could be. But no, it could be in medical term, we say rheumatoid arthritis is you have family history, your other joints are affected, but I need to rule out other causes such as, but osteoarthritis less likely because you're young, okay? It's very in older age, this one osteoarthritis. So you need to rule out, okay? Then you need to say, I will give you a painkiller, I will keep observation, I will run some blood tests, which include full blood count, the factor of this disease, and the condition, this condition. If it's confirmed that you have this problem, then I will refer you to rheumatologist for further and the management or refer for further treatment. This make it simple. Okay.
Right. Thank you very much.
Okay, so about your asking question, you're mixing everything. Are you? Do you have any dizziness, chest pain? No. You need to ask in chunk. How to say? In parts that the patient can swallow it. Also, not like you or sudden put everything on him and he cannot answer everything. Next is you must listen to patient. You should be a good listener. Why I'm don't going to correct you the history, because I know that when you will practice, you once you read the notes, you will follow it. The history taking will be corrected, but the management plan, like rush for all the information, no one can correct you. That's why I try to correct you. That first, you give information in chunk form. Second, you need to explain management plan very clear and in simple words. That's it. You're done. Other things you can practice, you will learn it. It's not a big deal. Even I can give this all information to non-medical profession. He can also learn that. It's not a really a big deal to just to memorize what is the step. Everyone can step, but the management plane, the rules and regulation, they cannot do it. That's why I'm stressing. Okay, anyone to practice next section? Just we have 2 more to go. 2 more. So who wants to practice? Anyone? Let's make it the like pain. It will be acute limb ischemia or DVT. We just go for the last station we have. This one. Anyone to practice? A very simple station, throat pain. Oh, we did it already, right?
We did it.
Did it, right?
Okay. Yes.
I'm sorry, we did it, so we don't need to practice this one. Okay, fine. So this was the last station. So how was the session, guys?
Wonderful.
Do you have any question? Yeah, do you have any question? Now you can ask me anything. I can answer you to the point.
Yes.
Yeah.
So I want to ask you, like in my last station, like hyperuricemia, I'm in gout, osteoarthritis, rheumatoid arthritis, all these are the differential diagnoses. So is it mandatory we should reach to the diagnosis? And of course, the treatment will be on the one diagnosis, right? But we are not, I don't think so that we are supposed to make the diagnosis only on the basis of history.
Very good question. Very good. Excellent. The previous exam is not from the pain, but it was from Odipara. Someone told me the lady is 54 or something. He told me she has vaginal bleeding. And unfortunately, the chart mentioned that you need to, they divide all things, so 30%, he told me that this is differential diagnosis. And he said when he take the history, the women always say, I'm worried maybe I have a cancer. So in this case, you need to, when they mention to you to tell the differential, you must tell the differential. In every management plan, you must tell the differential. Make your hobby. Make your hobby, because you must tell the differential why you think so this could be. That's like, as like I said, rheumatoid arthritis, because your family history, you're young. Osteoarthritis can be ruled out because it's in older age. Okay. So this can be can be differentiated this way also. So this is how he said the station. He said, well, not very good. But I told him the differential can be many. Fibroid can be differential. The endometriosis can be differential. So you need to explain her. He said, I missed it. Anyway, so this can be possible. Yeah, by chart. I will do in next webinar when I will make it. Any other question, guys?
So, could you just summarize all these in nice guideline managements, please? Like to be specific to pronounce during the management part.
Yeah, guys, what I'm going to do, I will send you the screenshot or slides, okay? You just read it and make your own word. Based on your information, the most likely problem this is, okay? What I'm going to do, I'm going to keep you in observation room. If you think of myocardial infarction, you say I keep you in resuscitation room. I will do examination of your heart or chest. Listen your heart sounds. You need to verbalize also if you can. If you have more time, you need to verbalize everything. If you want to get 100% your score, otherwise you'll lose some of your part. Okay, but about the management, what the drugs, treatment, I will send you. Okay.
Dr.
Or
B,
you want I should tell you each and everything, guys. I don't know who asked me a question. What's your name, please?
My name is
No, someone asked me this question to write down this plane. Okay, next please. Who was asking another question? Yeah, Dr. B, yeah, someone said.
Yeah, actually the previous question was asked by Dr. Ref, so he can continue. He asked you to about the vessel management.
Yeah, Dr. Rice, I don't know what you want to say.
As you said, I just wanted to know because all this management has been incomplete. So just to make it sure it's going to be completed every time. So I'd be appreciate if you can just summarize the management for each and every case. Let's say, for example, osteoarthritis, arthritis, according to the NICE guideline.
Yes, so I said I will do what I will do. I will take the screenshot from the NICE guideline and send it to you, and then you can make in your own words. Okay?
Okay, sure.
Just remind me today. I'm very busy. Tomorrow I will do it. Okay, next please. Okay. Another guys. Yeah.
Yeah, Dr. B. My question will link with the previous question that after differential diagnosis, we have to mention the treatment for I think one treatment only, right? It is impossible to give the treatment for gout, osteoarthritis, as well as for rheumatoid.
No, you don't need to mention treatment of differential. Just need to mention the treatment which you suspect. Okay, so you always say most likely. Do not say the confirm. Okay, so when you are going for treatment, you say I will do the blood test, I will do investigation. If it's confirmed that you have rheumatoid arthritis, then I will give you this medication. Got it?
Oh, okay.
Yeah, do not say, oh, likely problem, I will do this, go for treatment. No. You must say, I will do investigation, I will do blood test, I will do scan. If it's confirmed that you have this problem, then I will give you this treatment. Next question, please.
Yeah, Dr. B, one more question. In case of throat pain, so we have center criteria and fever pain criteria.
Throat pain, throat pain. Here I make the sore throat because its station already came up, but it can come up with a different way. Yes. Now your question. Continue.
No, we have to elaborate on the center criteria or fever pain criteria.
Anyone, both are the same. If you check it carefully, both are the same. No any different, big difference. They're all almost same. Anyone you can choose. You can mention that according to this scale, according to fever pain scale, you can just mention both one of them. No problem. Another?
Okay.
Any other question, guys?
Yes, when I am asked in history if I forgot something and I am going to summarize, can I ask them in the summary?
It wouldn't be concise if you ask in summary, but you can communicate, no problem. If you have time, you can ask, no problem. To confirm, could you please confirm me? For example, you forget something, in the end, it's come in your mind. Could you please confirm me that your pain is on the right side or left side? You can ask like this way. Could you please confirm me? That means it will show that you know it, but you're little bit forget. As a human, so it can be forget. So it's no problem. You can. Another?
Okay, thanks.
Thank you very much, guys, for joining. This is going to be end of the session today, and we will see you.
Thank you so much, sir. It was really helpful.
We will come up with new webinar with the Odipara. This station I left here, the leg pain. It can be acute limb ischemia. It can be DVT. If you get time, just check the treatment management. I already summarized in previous slides, so you know it. Just need to apply if the patient is hair loss, swelling, lump. Make sure the history taking, I share the slide with you guys. Follow it, practice with your colleague, practice. You just get grip on the steps and be concise. Rest things leave on me. I will correct you by management plan or everything. Okay. Have a nice evening and thank you for coming, guys.
Thank you, sir,
Thank
for
you.
your.
Thank you very much.
Okay, thank you.
Okay.